Welcome to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti. It's actually a special evening tonight on the Pete Mezzetti Show. My guest this evening is Dr. David Banach from UConn Health. This is the first time Dr. Banach and I have actually been in studio together. Usually we do this through Zoom. Welcome, my friend. How are you?
Good. Thank you for having me on.
Well, thanks for coming down. Thanks for coming down. So, what's new? There's a lot new.
Yeah, with infectious disease, there's always something to talk about. Happy to talk about a few different topics.
Okay.
Talk about what's going on with flu and COVID now and in the coming fall, and then also tick-borne infections. I think is a hot topic in the summertime, and happy to talk about that too.
All right, well, we'll start with the even easier question. Tell us a little bit about yourself and how long you've been with UConn Health.
Sure. So I'm a doctor at UConn Health. I've been at UConn Health now for a little over 7 years.
Okay.
And in my role, I take care of patients in the hospital. I see patients in the office with all different kinds of infectious diseases. And I also do some teaching in the medical school. And then in my other role, it's a mix of research, but also some administrative role in infection control and infection prevention for the hospital. So it's kind of a combination of different things at UConn. And I really enjoy that.
Nice, and I'm sure the pandemic has kept you exceptionally busy.
Yeah, geez, it's hard to believe it's going on 3 years now. But it's been busy. Always some new change or something new going on with COVID. But yeah, it's been a busy 3 years.
Absolutely. Now, is the virus over, or are we in?
So I think we're in a new phase. It feels like it's always a new phase of COVID.
Yeah, right.
I think the pandemic has been declared over. So that's the global pandemic that really was so disruptive, in the United States, across the globe.
Right.
So that part of COVID, I think the emergency phase is over. But now COVID, it's still circulating. So the virus is still out there. We're still seeing it circulate in the community. Unfortunately, we do admit some patients to the hospital with COVID infection. They generally tend to be on, older, higher risk groups that unfortunately get admitted to the hospital. But now we're in a place where we have a combination of immunity from vaccinations, from prior infection among the population, which has kind of mitigated the impact of COVID. And we also have some tools like treatments available for folks that do become infected with COVID. So we have a lot more in our disposal than we did, even just thinking back a year ago and certainly 3 years ago when this first started. We're in a whole different phase, but still something that the public should be aware of. I think thinking about what's going to happen in the fall, are we going to see increasing cases? Typically, here in the Northeast and in the United States, during the fall, we see respiratory viruses circulating a little bit more. So I think we have to be attentive to that, and we have to take it one step at a time.
Absolutely. Now, can somebody actually have COVID and not know it? Meaning it feel like a cold or?
Yeah, I think we're seeing milder infections overall. So now, as I was mentioning, there's everyone, the large percentage of the population has been exposed to COVID.
Right.
So there's going to be some protection against a re-exposure. In general, those infections tend to be milder. I think the question comes up, in the future, is that protection that's from prior infections, from vaccination, going to wane over time, and maybe people will develop more severe infections overall? I think that's, to be determined. But I think in general, we're seeing milder infections in most individuals. But certainly those individuals who are older, those who are more vulnerable because of medical conditions, they can still develop very severe infections that can lead to hospitalizations.
Now, is there another shot coming down the road, or?
Yeah, I think that's a great question, and something that I anticipate will develop. But there's anticipation that in the fall there'll be an updated booster.
Okay.
So we've seen we've seen the vaccine be updated to match the circulating strains, kind of like what we do with the flu vaccine.
Right.
So I think it's anticipated that in the fall we will see an updated booster. Still waiting on the final details from FDA and CDC regarding the recommendations. Is it something that's going to be recommended for the general population? Is the recommendation going to be different for higher risk individuals? I think that is still, we're still waiting on public health guidance regarding that. But I do anticipate there'll be an updated booster available in the fall, winter time, which hopefully will help provide extra protection.
Absolutely. Now, is there a difference between the three manufacturers' shots
So there are differences, and they're subtle. So the Pfizer-Moderna vaccine that uses the mRNA technology. I think on previous shows we've talked about that a little bit. So that's a sort of a novel way to generate an immune response. The Novavax is the third vaccine that's available. It's a little bit more similar to the previously existing vaccine technology in the way that it generates an immune response. But they all really focus in on the same part of the virus and generating protection against that particular part of the virus to provide protection. But they're all very extensively used. We now have a lot of data on their efficacy and safety, and I think I don't know exactly which vaccines are going to be available in the coming winter, but I think it's important that we have multiple options moving forward.
And it's obviously most important to go get your shots.
Yeah, I think we're seeing that the vaccines, are still effective. They do provide protection, particularly for those who are most vulnerable. I think those are the groups that really, need to be vaccinated most. I think that the healthy young population, I think there's still benefit there. But I think focusing on those older individuals, people with other medical conditions, it's really critical protection from those vaccines.
Uh-huh. Now let's talk about tick-borne infections.
Yeah, tick-borne infections, that's something, here in Connecticut, we've sort of been the epicenter. So, Lyme disease, was, first identified among patients in Lyme, Connecticut.
That's right.
So these ticks, have been with us, and we are learning more and more about the different infections that they can cause. We have a certain species of tick here called the Ixodes tick, which carries some different infections, including the bacteria that causes Lyme disease. Two other important infections that we see commonly are babesiosis and anaplasmosis. We talk about they're a little bit different than Lyme disease, but carried by the same tick. And now there's also a virus that's emerging, much less common, called Powassan virus, carried by the same tick, and can affect people here in Connecticut. I think important for the public to realize that this particular tick season has been that we've seen a little bit more in terms of tick-borne infections, probably relating to the milder winter that we just had.
Right.
So a little bit more ticks that are out there, and important that the public know about these infections, particularly here in Connecticut, and also what they can do to protect themselves.
Now, can we maybe talk a little bit about the different types of the ticks and maybe get into a little bit more detail on each topic?
Sure. So Lyme disease, that's the most common infection that we see here in Connecticut. We think about it, it's caused by a certain type of bacteria that the tick can transmit to people when it sort of comes in contact and basically bites people. Right. The most common manifestation we see from Lyme disease is that classic rash, so the bullseye rash, called erythema migrans, and we see that as sort of the first sign of infection. And when we see that, very treatable. We have antibiotics that are effective in treating Lyme disease. In some much less common situations, we see later manifestations of Lyme disease. It can show up as ways that it affects the joints, way that it can affect the heart, and that's much less common than the skin rash that we see. But these are all treatable with antibiotics, and important that if you do see a rash, or if you see like unusual symptoms in the summertime, that you get checked out by your doctor and determine if you need to be treated or tested for Lyme disease. Like I said, we have very effective antibiotics for treating it. The other two infections, so one's called babesiosis. Yeah. That's actually a parasite that's carried by the same tick that carries Lyme disease. The symptoms are a little bit different, tends to cause more like flu-like symptoms, so fevers, kind of achiness, and in some severe cases we can see people admitted to the hospital with this infection. Some people are more vulnerable, particularly elderly folks, and folks that may be immunocompromised are more vulnerable to that infection, but that's another tick infection that we see here in Connecticut. And then the third, the most common, is called anaplasmosis, carried by the same tick, a different bacteria, can cause similar flu-like symptoms, and we do see generally people have milder symptoms, but in some severe cases, we do see people coming into the hospital with these infections. So all things that here in Connecticut we have to have on the radar The typical situation we used to see is in the summer, if someone came in with like a flu-like symptoms,
Yeah.
we don't really see flu in the summertime, but we'd have to think about these tick infections, and really important that we accurately diagnose them and treat them early so that you prevent them from progressing to more severe symptoms.
Absolutely. Now, how important is it that you get your flu shot when it's time?
Yeah, so the flu is with us. We've seen it's been an interesting pattern over the last 3 years.
Right.
With COVID kind of becoming the dominant virus.
Yes.
Flu seasons have been a little bit milder, so a little bit unusual. But remember, we had all these other measures that we were using during COVID, so less social contact, wearing masks, things like that. That probably had an impact on flu as well.
Right.
So we saw milder flu seasons the last couple of years. It's always difficult to predict both how severe the flu season is going to be and also when it's going to occur. So
Right.
the classic flu season used to begin early, like September, and last through March. The last couple of years we've seen a little bit later in terms of flu activity, but it's always a little unpredictable. So we have to think about what we have for protection, and really the flu vaccine is critical in terms of protecting against severe flu infections. So there'll be an updated flu vaccine. I anticipate it's probably going to become available next month.
Okay.
And I think it's going to be, just like in previous flu seasons, recommended for everyone to get to protect themselves from the flu that we anticipate will be coming in the winter months.
Absolutely. So go get your flu shot.
Yeah, I think we know the flu vaccine's been around for a long time. It has a great track record, and it's going to be available this coming fall. So everything that we can do to protect against respiratory viruses is going to be key, and the vaccine for flu is going to be a key part of that.
Now, in your position with UConn Health, how closely do you guys work with the Department of Public Health?
Very closely. So, our hospital and hospitals throughout the state all interact very closely with our Department of Public Health in a lot of different ways. So, we work closely when we think about ways to keep patients in the hospital safe. So, particularly during COVID, we had a lot of collaborations, both in terms of developing protocols to protect our patients, but also ways to collect data on our test results and submit that to the state so that the state can sort of understand what's happening with COVID and other respiratory infections. Okay. And then, we work closely with the state for other infectious diseases. So we have a whole list of infections that are reportable to the state, including things like babesiosis and anaplasmosis. So it's really important that all the hospitals share that data with the state so that the state knows kind of what the situation is with all these different infections. So there's a whole list of infections that we are required to report and submit our data to the state so that they can collect that and understand the way that these infections are transmitting. And then, of course, there's a few like very high consequence infections that we rarely see that would have to be reported to the state. So a lot of that communication takes place, and it's bidirectional too, that we report our data to the state, but then the state can help us too. They can help provide resources to laboratories to help with testing. They can help provide resources to hospital to do things like patient outreach and sort of follow up with patients when there's concerns about infection. So it's a very close relationship, but it's really key.
Now, once they report the results to the state, obviously the state compiles and collaborates, and then what do they do with it? Yeah,
so they do a few things. So they collect state data, and sometimes for some infections it gets passed on to CDC for national data. So for a lot of these infections, we see our state reports, but we also function as one of the 50 states here in the U.S. So we collect our data, send it to CDC, and that's when we start to see like national reports on all different kinds of infections, from flu to COVID, and then even things like hospital-associated infections like multi-drug antibiotic-resistant bacteria. A lot of that is tracked very closely at the national level. So that is one thing that the state does with our data. But they also can do things like patient outreach. So when patients get discharged from the hospital, they can help with follow-up testing. If there's concern about exposures that may be occurring in the community, they can reach out to wherever they think that there might be an exposure occurring and intervene to try to protect the public. So a lot of things that they do with our data, and that bidirectional collaboration with the Department of Public Health is key.
Wow, it sounds like it's very detailed.
Yeah, it can be, and it can be complicated, but I think we have great people working at the state who really help facilitate that collaboration and. Make it. It's never going to be 100% perfect, but it does go remarkably smoothly. And I think it's also really important that the state support the Department of Public Health to help because of their key role. And that's something that we always worry about, funding for public health, and is the public health infrastructure going to be supported financially? And I think it's key. It helps hospitals, it helps the public stay safe. So I think just a plug to support our Department of Public Health with providing them the resources that they need to do the important work that they do.
Just by seeing the commissioner of the Department of Public Health on the news, she sounds like she's very educated and she's very, very smart.
Oh, she's excellent.
Is she?
Yeah, she's an infectious disease trained physician at Yale.
Oh, she is?
Yeah, so she worked at Yale as a clinical infectious disease doctor.
Okay.
And did great work there, both in terms of patient care, but also in terms of her research and sort of public health approach. So she comes from a great clinical background, but also a really strong research and administrative background. So she's great. She's really been a terrific leader, and I hope that we continue to support her in that role.
Yeah, absolutely. I've seen her on the news. She sounds like she's very well educated.
Oh, absolutely, and particularly with infectious diseases, that's
right.
our focus. So we're very fortunate to have a strong leader of our Department of Public Health, but Dr. Ciucciani also has really that infectious disease background, which over the last 3 years has been so critical.
Somewhat helpful.
Absolutely.
And I'm sure the governor's office and the governor are glad everything is sort of quieted down, because
I think so. I think Governor Lamont's been really supportive of the public health department over the last 3 years, and I think he recognizes how critical our state is, and our state government leadership is in protecting the public from infectious diseases, but also keeping Connecticut healthy.
Now, as far as keeping yourself healthy to the time where we are now, what can you continue to do?
Yeah, I think the governor. I think the support of the Department of Public Health is really critical. So the Department of Public Health, as we talked about, they perform an important service for all of the residents here in Connecticut. Everything from helping support infection prevention like vaccinations, they help with all of our data collection, they help address outbreaks when they occur in all different types of settings throughout the state. So I think if the governor can continue to support public health, I think that's going to be critical, and I'm optimistic from what we've seen with Governor Lamont that he will continue to do that, and that's very encouraging for us here in Connecticut.
Absolutely. Now, what is RSV?
So RSV, it's the acronym we use for respiratory syncytial virus. So it's a respiratory virus, just like the flu and just like COVID. These are respiratory infections. And RSV, even though it's gotten a lot more attention in the last few years, it's not new. It's a virus that's been around for a long time. Typically we really saw it affect only certain groups of the population. So very young children, so neonatal like babies, got very severely affected by RSV. And then the elderly and immunocompromised group also we would see get severe infections. But then for the general public in that middle group, infections were generally mild, so was not really a concern, and that continues to be the case. We over the last year, you may have heard in the children's pediatric world, we saw a surge of RSV cases, and the hospitals that take care of kids here in Connecticut started to see a real surge of patients coming in with RSV infections, more than that had ever been seen before. And I think that really put a stress on the pediatric hospitals, and I think it's hard to know if that's going to be something that we see in the future. But RSV is one of those infections that we've always kind of had an eye on, but has really proven over the last year or so to be very impactful. I think something that we have to keep a close eye on and see how it impacts both all groups of people, but particularly those vulnerable groups like young children and the elderly and immunocompromised, and prevent those hospitalizations. We have some new tools which we can talk about. Vaccination.
Yeah, go for it.
RSV.
Yeah, go for it.
So in the last year, and actually the last few months, RSV vaccines have been approved by the FDA, both for preventing infections in elderly individuals. So the vaccine over the last year, data has come out that it can protect against severe infections, hospitalizations among those over age 60. So the CDC is now recommending that anyone over the age of 60 get an RSV vaccine to prevent those more severe infections that we unfortunately see in the hospital. So that's going to become available soon, I think probably within the next few weeks. And I'd encourage anyone in that age group to go out and get vaccinated for RSV, because it can really be very impactful and cause severe infection. So the RSV vaccine for that group is going to become available soon. Now the other group that is going to be a focus of RSV vaccine are pregnant women. So the goal is that we give a vaccine to pregnant women so that they can generate antibodies and pass them along to the babies and prevent the babies from developing severe RSV infection, because we know that those young babies are particularly vulnerable to RSV. We now have FDA approval for the RSV vaccine in pregnant women. Still waiting on the final word from CDC as far as what's going to be recommended in that group, but I think in the coming weeks we'll get some more clarity on the vaccination for pregnant women, and that'll be really important in protecting the young babies from RSV infection. So a lot of enthusiasm. I think from what we saw the last year, the RSV can be very impactful, can really cause a lot of hospitalizations in those vulnerable groups, but now we have ways to prevent that from happening through vaccination.
Now, obviously, the RSV vaccination is going to be like a shot, like
it's
COVID,
it's a vaccine,
or a flu shot.
Yeah, just like these other respiratory viruses, it's a vaccine injectable. It uses more traditional type of technology, not quite the same as the Pfizer and Moderna COVID vaccines, but generates immunity and protection in a similar way. So yeah, it's going to be another sort of tool in our toolkit to try to prevent those severe consequences from RSV.
Now I know during the COVID era, you could get the at-home testing kits and do it yourself. Yep. You might say. Yeah. Those things, are they as accurate as they seem, or?
Yeah, they still hold their accuracy. So we've seen these new variants of COVID come out, but the way that those home tests work, they detect a part of the virus that hasn't significantly changed. So they are still accurate. Okay. I think it's important to recognize that they're not perfect. No. So I always encourage someone, if they have symptoms of COVID and the initial test is negative, to actually repeat the test, usually about 24 hours later. Yep. To try to give a little bit more confidence if it is truly negative or not. So they are available. One thing that I always encourage people now is to take a look at that expiration date. A lot of the COVID tests were produced a couple of years ago, right, during that initial surge of COVID. So if you have a test lying around that was given to you a couple of years ago, double check that expiration date, because unfortunately it may have expired. But the tests are still available. I think what we're seeing more is a movement away from testing sites. So you may recall that throughout the state during the peak of the pandemic, different hospitals and clinics had drive-through testing sites. Mm-hmm. We're kind of moving away from that model and more towards what we've done for regular flu testing. So in your urgent care clinic, in your doctor's office, you'll be able to get tested there, kind of decentralizing the testing that's available to the public. So we've got home tests. Check the expiration date if you are going to use a home test, and then now tests are becoming more readily available in doctors' offices and clinics. So kind of a shift in the way that we do testing, but fortunately the testing are still available and accessible by the public. And I think important to know that if someone does have symptoms of COVID and they want to find out if they have it, the tests are still out there and available.
Now, if the person goes ahead and does the home test, do those numbers get reported to the state or no?
Yeah, unfortunately they don't.
Really?
So that's a limitation. There have been some different ways that we've tried to collect home reported data, and some states have systems in place where they can do that, but it's really difficult, and unfortunately I think it leads to a lot of undercounting of cases. Right. We still report tests that are done in the hospital. Emergency departments still report their positive tests, and that gives us a rough gauge as to how much COVID is circulating in the community, but the home tests, that's a limitation, that we just don't collect data from them. So important to recognize that, but I think we have other surveillance data systems in place that we can use to try to understand how much COVID is out there. And wastewater testing, I don't know if we've talked about that before.
No, we haven't.
Yeah, so wastewater testing is now one of those tools that we can use to to identify how much virus there is circulating throughout the state in different towns and communities. So Connecticut has several wastewater collection sites throughout the state where they actually sample wastewater and look to see how much virus is circulating in the wastewater. And that's a way to kind of understand if we're seeing increases or decreases in the amount of COVID that's circulating. And I think that tool will continue to be used in the future and be an important part of our public health surveillance for COVID.
Now, how accurate is wastewater testing?
I think it's accurate. It's important to recognize that it's not a perfect science as far as understanding like exactly how many cases of COVID there are in a given town or a given county.
Right.
But it's good for tracking. So if we collect data over the course of a year and we find that we're getting into November and we're starting to see increases, that helps us give an estimate that there's probably increases of COVID infections occurring in the community. So it's a tool, it has its limitations, but I think it's valuable, and it's something that I do anticipate in the future we may start to see expanded to other viruses too. So in the future, if we start collecting information on flu in the wastewater or RSV, it'll help us know if we're starting to see an increase in virus presence in the wastewater, and maybe that could be an early sign that cases are going to start to increase, and even potentially like hospitalizations, so we can prepare accordingly.
Now, can you maybe explain how the wastewater testing works?
Sure. So essentially, a sample is collected from these different wastewater sites throughout the state.
Okay.
And we can actually kind of quantify how much virus is present there. So we do molecular techniques to identify virus presence, and it helps us, again, give an estimate as to how much virus is present in that particular sample. And then based on that, we can say, okay, this county is seeing a higher amount of virus present, so there's probably more COVID cases in that county, or this town is seeing higher rates of COVID in the wastewater, so there's probably more virus circulating in the community. So, it gives us an estimate to kind of compare geographically, that certain areas may have higher rates of COVID that are circulating in the community, but also helps us over time to see that, we're starting to see an uptick in wastewater sampling virus, and, that may tell us that a few weeks from now we might start to see more cases of COVID in the emergency room or in the hospital. So it kind of can help us make some prediction in that sense.
Now, once they get the wastewater to be tested, where do they send it? Send it to like a lab?
Yeah, it's done through labs all coordinated by the state health department.
Okay.
So there's different labs throughout the state that do the testing, and that data is collected centrally by the Department of Public Health. And then the CDC actually has some national sites throughout the country where they also collect wastewater testing data to help us know that, okay, in the northwestern part of the U.S., we're starting to see higher rates of COVID circulating. So we have to kind of be ready for that. Start to prepare for more hospitalizations, more emergency room visits. But in the southeast, maybe we're not seeing so much COVID circulating. So it gives us kind of one tool to measure the relative amounts of COVID that's circulating in different parts of the country. So we use it at the state level, we can use it nationally, and I think one of those new tools that before COVID we never really used it as a public health tool, but I think we're starting to recognize that it has value, and I think we'll be using it a little bit more in the future.
Would you mind sticking around for another segment?
Of course.
All right, we'll be right back.
You matter.
You matter.
And your words matter too.
Your words matter.
What you say in the hallways at school or in the student section at a game matters.
Words can be hurtful.
Words can be offensive.
Words can leave scars.
Words can also inspire.
Support and uplift.
You and your words.
Are they both important?
As a matter of fact, yes.
Cybersecurity experts at the Federal Trade Commission warn that bad actors can load malware onto public USB charging stations, locking your electronics or exporting personal information like passwords to a scammer's device. To prevent your phone or laptop from being attacked, they suggest using AC power outlets and your own USB cables. And if you plug your device into a USB port and are prompted to share data, trust this computer, or charge only, always select charge only. You can find more travel tips at bbb.org/travel.
Welcome back to this week's edition of the Pete Mezzetti Show. I'm Pete Mezzetti, sitting here with Dr. David Banach from UConn Health. Welcome back.
Thank you.
Thank you. All right, so let's see. What do we want to talk about? Let's talk about what's going on in on the water.
So yeah, there's been an infection that's gotten a lot of attention in the news, particularly here in the shoreline. Unfortunately, we've seen a few really severe, even fatal cases occurring from this waterborne bacteria.
Okay.
So the bacteria is called Vibrio. It's a bacteria. It's not a new bacteria. We've known about this for a long time. It's a bacteria that lives in the ocean. It can live in mollusks, so like oysters, and it can be transmitted to humans in one of two ways. So either through ingestion of the bacteria, so eating uncooked shellfish can be one way that it can be transmitted to humans, and then the other is through contact. So the bacteria circulates in the ocean, and if someone were to go into the ocean with an open wound, it could enter into the wound and cause people to get really sick.
Yeah.
So it's something that we've known about. As I mentioned, there were a couple of very severe cases here on the shoreline, and for people that were exposed to either directly to water in Long Island Sound or to shellfish that were collected from this area, led to people getting really sick. So it's out there. It's something that people who are immunocompromised are at particularly high risk to get severe infections. People who are younger, healthy, may get milder infections, and that they may resolve relatively easily. But it's those vulnerable people, the compromised folks, that unfortunately can develop really severe infections, end up in the hospital. And we have antibiotics that effectively treat this bacteria. So every year we see a couple of patients come into the hospital with really severe infections, and they're treatable. Particularly if we identify them early. So I think important that the public know about this. I don't think in terms of the overall impact on the public, it's something that people should be fearing.
Right.
But certainly, if you are in the ocean, come out and feel like you're sick. If you have a wound that looks like it's getting infected, after coming in the ocean, you got to get that checked out. You can't delay on it, because that's the kind of thing that can progress and lead to really severe infection that can land people in the hospital. So anytime that you see a wound, a cut, something that looks like maybe a skin infection, if you've been in the ocean, make sure you got to get it checked out, and please tell your physician or whoever clinician seeing you that you were just in the ocean, that you had that exposure, so that type of bacteria infection's on their radar when they're deciding about how to treat you and what antibiotics to give you to try to help resolve the infection.
Now, if you're in the ocean, should you go to, and you have an infection, should you go to the emergency room, go to the hospital, go to your doctor?
Yeah, it depends on how severe it is. If it's a milder infection, maybe the kind of thing that you can see, at a walk-in clinic, you may be able to go see your doctor. But if you're at home, you notice that, infection is progressing quickly, or you start to have fevers and feel like you're getting sick, then, you can't really delay on that. You got to go to the emergency department, and, they'll be able to assess you and take care of you, and, treat you as you need to. Again, hospitalizations from these kinds of infections is not it's very uncommon, but it can happen, particularly if it's something that's kind of delayed in terms of getting treatment. So I think the main message is, if you do have any concerns about a skin infection after being in the ocean, you get checked out, and make sure that you let whoever's taking care of you know that you had that exposure, so that they're thinking about this potential infection.
Now, as far as other topics of interest, what else you want to talk about?
Yeah, one thing that is getting a lot of attention is antibiotic resistance. So that's something that I think we've been battling this ever since antibiotics were created. Seeing more and more antibiotic-resistant bacteria, and I think interestingly, over the last 3 years with COVID, we've seen a lot more infections, a lot more antibiotic prescribing. So the concern is that's going to lead to more antibiotic-resistant bacteria. So I think that's something that we deal with in the hospital a lot. We see patients come in, and unfortunately, they've developed an infection that's resistant to a lot of antibiotics. But I think it's important for the public to know about, not so much to cause fear, but to make people know that these antibiotics that we prescribe, they're necessary when they're needed to treat infections, but overusing them can lead to these kinds of problems. So we know that when we prescribe antibiotics, they have a very specific reason that we're prescribing them. We're trying to treat a certain kind of infection, but when they're prescribed when they may not be helpful, so people who have the flu or RSV, the antibiotics may not necessarily be helpful for them. So we see patients coming in requesting antibiotics when they have a viral infection that really we shouldn't be treating with antibiotics. Right. So important that we recognize that and know that antibiotics have their place when we need them, but by prescribing them when they're not needed, we're probably adding to that antibiotic resistance issue. So it's a big public health issue. I think something that the public should be aware of, and when they see their clinician, their physician, or whoever's taking care of them, letting the clinician do the appropriate test, make the decision about whether or not an antibiotic's appropriate, as opposed to going into request an antibiotic, that I feel sick, I need an antibiotic. So kind of being mindful of that downside of antibiotics, that it's sort of when they're not necessary, they can promote that resistance. Antibiotic resistance is something that the public, I think, should have on the radar as well.
And I'm sure people will go in for the antibiotic and not need it, or
yeah, we see that. I think that's one of the benefits of having more testing available for COVID, for flu, that we can actually make that diagnosis that, okay, this person has a cough, has a fever, and we can test them for COVID. We find, okay, this is caused by COVID or this is caused by the flu. You don't need an antibiotic. So having that testing readily available, I think, is important in helping with making that decision about whether antibiotics are going to be helpful or if they're not going to be necessary in a given situation.
And maybe just let it run its course. Or
yeah, a lot of young healthy people, when if they get the flu, they get a respiratory virus. Even with COVID, young healthy people, it'll resolve, with time and supportive care. So, doing things like, taking Tylenol to help with a fever, staying hydrated, getting rest, these kinds of things, and the infection does resolve. Again, those older individuals, they may benefit from some of the outpatient treatments for COVID. Right. They do benefit. So, if you're older, if you have medical comorbidities, other conditions, if you're vulnerable by being immunocompromised, antiviral treatment can really be beneficial in terms of preventing progression of infection. But antibiotics that we use to treat bacterial infections, don't really have a role in that kind of situation. So if they're not necessary, I would encourage people not to take them because of the downsides and development of more antibiotic resistance.
Now, I know we talked about the virus in the first segment, and we talked about the home tests. After they expire, should you just throw them out, or what happens if somebody tries to use them after they expire? Are they still going to be accurate?
We don't know. Yeah.
Do we know?
I think that the tests they may be accurate, but we can't be assured that they're accurate. So, they have the liquid that we use, and if it expires, they may not necessarily be as accurate. So, I would encourage people not to rely on an expired test. I think, if your test is expired, dispose of it, and if you want to get a test, they're now readily available in pharmacies. So I'd encourage you to get a test that's not expired. I think the quality of that is going to be more assured, and that you're going to get an accurate result. Again, an expired test, it may work, but certainly we can't guarantee that it's going to be effective. So I'd encourage people to discard their old tests that are expired, and if they need to get a test, to go out to they're like I said, they're readily available in retail pharmacies, and go out and get a new test to feel a little bit more confidence that the result you're getting is going to be accurate.
I actually remember my first test when the virus first came about. I went up to the Middlesex Hospital in Middletown, was was one of the first testing sites, and my mom was like, I don't feel well. So her, my dad, and myself got in the car on a Sunday morning, up to Middletown. Do you know how to do this? No, here, lean back.
Yep. Yeah, it's interesting. We all learned a lot about virus testing very quickly when COVID first appeared. But the tests have proven to be valuable. They're helpful both for knowing that that's the cause of symptoms, and so you can kind of protect other people around you by doing things like wearing a mask and keeping distance from other people when you're sick. but also helpful for those who benefit from treatment. So, I think with a positive test, knowing that that's the cause of your illness and that you're in that group that's more vulnerable, reaching out to your doctor, saying, I have COVID. I'm concerned that I'm at higher risk because of my age, because of my medical conditions.
Right.
Am I a candidate for Paxlovid, which is the main antivirus treatment that we use now for taking care of patients with COVID.
I've actually seen commercials on TV for Paxlovid recently.
Yeah, I mean, it's still available. We still prescribe it.
Oh, do you?
Yeah, it's still effective. We still, like I mentioned earlier, COVID, even though we're out of an emergency pandemic phase, it's still circulating in the community. So, we're still seeing COVID cases occurring. For those individuals who are higher risk and more vulnerable, Paxlovid is a really important part of our efforts to take care of them and keep them from progressing to needing hospitalization and getting sicker.
Now, what exactly is Paxlovid?
So it's an antivirus medication. So it acts on blocking the virus from replicating.
Okay.
So it kind of stops that whole process and can help prevent viral replication and more severe symptoms. So it's very important to be given as early as you can. So, as soon as you get that positive test, reaching out, starting early before the virus has time to replicate and cause more severe symptoms is really when Paxlovid can be most effective. So, as soon as, if you get symptoms, test positive, reach out to your doctor to see if Paxlovid is really a good option for you, and try not to delay too much because it's most effective when taken earlier.
Now, besides Paxlovid, are there other options out there?
There are. There's a medication called remdesivir. That's an intravenous medication. We use that pretty much exclusively in the hospital for patients that have COVID. So that and Paxlovid are really the two main treatments. We have a couple of other medications that we use in really severe cases, but really remdesivir, the intravenous antiviral that we give in the hospital, and Paxlovid, the oral antiviral that we generally give to folks outside of the hospital with COVID, are kind of the two main treatments. You may remember we had monoclonal antibodies in the earlier days.
That's right.
So those were the initial treatments that we had for our patients, and unfortunately, with the way the virus has evolved over time and mutated, those monoclonal antibodies have lost their effectiveness. So those aren't really part of our treatment arsenal right now. It's really the antiviral medications that are available to us now. But I anticipate that there'll be newer treatments in the years to come that are going to be even more advanced than the current antiviral treatments. So stay tuned on that.
Exactly. And so there's more stuff coming down the road.
I think so.
More stuff coming down the road.
Yeah.
Now, as far as, let's see. What else?
I think one thing, going back to the tick infections.
Yes, yeah, we can do that.
A lot of people ask, what do I do if I find a tick on me? So I'm feeling fine, but I noticed that I just picked a tick off of me. Okay. Is there anything that I need to do? One thing that we sometimes do in some situations is we can give an antibiotic to prevent things like Lyme disease.
Right.
And we give it in certain situations. So some of it depends on how long the tick has been on you. Does it look like the tick is the type of tick that causes these infections? So first step I would say is if you do find a tick on you, remove it.
Right.
Go reach out to your doctor. Say, I found this tick on me. Am I someone that should get a prophylactic antibiotic to prevent Lyme disease? And in some situations, if the tick has been attached long enough, if you're within a window period of being able to get early treatment or early prophylaxis, it may be appropriate for you. So, if there's any doubt, reach out to your doctor and ask if a tick or a Lyme disease preventive antibiotic would be beneficial. And then the other question we get a lot is, what can I do to try to avoid these ticks and prevent these tick infections from happening?
Right.
So there's a few things that people can do. So first, if you're going to be out in the woods, coming inside, do a tick check. If the earlier you remove the tick, the less opportunity that tick has to actually bite you and transmit one of those tick-borne infections. So do a tick check. If you're with your children, they come out of the woods or they've been outside for a long time, check their bodies for ticks. Sometimes the ticks can hide in little crevices like under the arms or behind the knees. So really doing a good tick check is important. Taking off your clothes and showering can be beneficial.
Yep.
So when you come inside, take the clothes that you're out in the woods with, put them in the laundry, wash them right away, usually under like a high heat. can be beneficial, and jump in the shower to try to prevent ticks. That's another thing that people can do to prevent the tick from kind of attaching and causing infection. And then there's tick repellents too that are out there. They're available usually by spray.
Bug spray.
Tick specifically.
Okay.
So if you know you're going to be out in the woods, you're living on the shoreline where we know there's a lot of ticks. If you're going to be out there, spray yourself with a repellent that's specifically tick repellent, and that can help prevent ticks from attaching to you and causing infections. So a lot of things that the public can do to try to prevent these tick infections that we had talked about earlier. But certainly, if you get symptoms and you've had any exposure to the outdoors, to the woods, going and get checked out to see if you do have one of those tick infections is the next step.
Now, are there different tick sprays out there in the world?
There are. The most common used one is called DEET. It's a chemical that's and that's the one that's kind of tried and true.
Okay.
A great resource is actually on the CDC website. So if you go into Google and type CDC recommended tick repellents, or they'll give you a whole list of different products that are sort of approved and recommended as effective tick repellents. But most of them do contain DEET. There are some that don't, that are recommended. That's a great place to start to get sort of a list of tick repellents. And then at pharmacies, they're generally available. So again, I think it's just another way that we can kind of prevent these infections from happening. And I'd encourage folks, especially if you're going to be in the outdoors. We see patients that are out in the woods, or patients that are even cutting their lawn.
Right.
The ticks are out there,
Absolutely.
and doing everything you can to try to prevent these infections is really is important.
For like a tick-borne infection, what type of antibiotic would you?
We've got a few different antibiotics. It depends on which infection you have. So,
Okay.
For Lyme disease, we have a couple of antibiotics that are very effective. For babesiosis, it's a little bit different in terms of the antibiotics that we have available. So it really depends on the specifics. And fortunately, we have good testing available to detect things like babesiosis and anaplasma, and help make a very clear diagnosis to guide the decision about which antibiotic is needed for which infection.
Now, how long normally is the person on the antibiotic for?
Yeah, for those it tends to be usually on average about 10 to 14 days. Again, it depends on some of the specifics of which infection, but it's usually that type of duration that people are looking at if they do have one of these tick infections.
Absolutely. Now let's talk a little. I know we talked about it in the first segment about the water and the bacteria on the shoreline.
Yeah, I think again, Vibrio is the main one that we've been seeing recently. I think one thing to think about is with changes in the environment. So we have a warmer summer, we had a milder winter. How does that affect bacterial growth in the water? Right. It may have an impact. And then even thinking more broadly about things like changes in the climate. What is that going to mean in terms of water organisms? We may start to see these organisms more frequently. We may see different kinds of infections occurring in the environment as the climate changes. So, I think these infections are out there, and again, important to know kind of what the different risks are. Again, these are relatively uncommon infections, but they can be very severe. So, I think the main message is if you start to feel sick, and you've been exposed to fresh water, here in Connecticut or the ocean, make sure that you tell that to whatever clinician is taking care of you. That I have these symptoms, but by the way, a couple of days ago I was just swimming in the ocean, or I was just, in a lake.
Right.
So I may have. It kind of expands the thinking in terms of what could be causing symptoms. So I think, again, this is going to keep changing. We'll learn more about, different risks associated with water. But I think that piece of giving that history to whoever's taking care of you is important, because it'll help with that decision making about what kind of tests need to be done and what the best treatment is.
What are some of the treatments that it can be?
Typically antibiotics. A lot of these waterborne infections we treat with antibiotics that are designed to kill the bacteria that's causing them. There's some other infections, things like parasite infections that are in certain types of water environments, and we have very specific medications for those. But in general, they're antibiotics and medications that are designed to end the infection by killing the organisms.
And usually, if they take the medication as
Yeah, people
prescribed,
recover.
it usually recovers.
Yeah, the recovery is generally good. Again, we've had a couple of those rare situations where patients are further along and come in with much more severe infections, and those are the ones that the recovery may not be as good. But for most people, if you get checked out early, get started on the appropriate treatment, the recovery for them is generally good.
And as far as, let's talk about how important it is to go get your flu shot this year.
Yeah, again, critical. The flu shot is basically the main tool that we have to prevent severe flu infections. So, I think the flu vaccines will probably become available in the next month. Certainly, it's a good time to reach out to your doctor, whoever you get your vaccine from, your pharmacist, and see if those flu vaccines are becoming available. I think anything that we can do with flu and RSV and COVID circulating to protect ourselves is going to be really critical. So, I think with the coming winter, thinking about preparing in advance, these vaccines are effective when they're given before getting an exposure. So, sometimes we see folks come in with a severe flu infection and like, oh, I was thinking about getting the vaccine, but now I actually have the flu, and really missed out on the opportunity to protect. So, I think this is a good time to start thinking about that with the coming winter. And if you're over 60, thinking about RSV vaccines, COVID, and flu vaccines, that'll be part of the infection prevention moving into the winter months. So reach out to your pharmacy or doctor or whoever takes care of you and say, when are these vaccines going to become available? I want to do what I can to protect myself, and going out to get those vaccines is important.
Now, can you do all the vaccines in one shot?
Yeah, you get them at the same time. They're not yet available all in one shot, although there is talk that in the future, the COVID and the flu vaccine may actually be a combined one-shot vaccine, which would be great.
Really?
But you can get them at the same time.
Yeah.
That's not a concern. If that's what is most convenient for you, by all means, a COVID and flu vaccine can be given together. I think with the RSV vaccine, it's anticipated that you'll be able to receive those at the same time. We haven't gotten the final word from CDC as far as any specific requirements. So, I think just asking in advance once those official guidelines come out for all these different vaccines, reaching out, can I get them all at the same time, or should I space them out? I think that would be a great question to ask your vaccine provider, whether it's a doctor or a pharmacist or whoever you're going to get your vaccines.
Now, as far as vaccines for COVID, you think that we're going to see something in the fall?
I do. I think there's going to be an updated, vaccine. Much like how the flu changes every year, we're seeing that the COVID virus is changing as well. We're seeing these newer variants, and I think the better that we can target those newer variants, the more protection there's going to be. The last booster was an updated variant. I think the next booster will probably be even more updated, and I do anticipate it'll come into the fall, winter. Again, we don't have the exact timeline yet. I think we're still waiting for some, final updates from FDA and CDC. But I do think there'll be some updated vaccines coming in the near future.
And then they figure out what age group you're in, so you get the elderly go first, and then they break it down that way.
Yeah, I think it's not clear if the recommendations are going to be different for older, more vulnerable folks than for younger folks in terms of the frequency of vaccine recommendations. So, it's probably been about a year since most people got their last COVID vaccine, although older folks were eligible for a vaccine, a few months after their last booster. So whether those folks will be the focus will be on more frequent vaccines, like every 6 months, whereas for the younger population, it may be less frequent, like every year. I think that's still something that we're trying to feel out, and a lot of it's going to be based on what we're seeing in terms of the effectiveness of the boosters in different populations. So, younger folks may have a longer duration of protection than an older individual. So the younger folks may need to get boosters less frequently than older folks. I think that's still something that we're learning about and trying to figure out because a lot of people ask how often am I going to need to get a COVID booster? I think we just don't know the exact answer to that yet.
Yeah, right.
But I think with time we'll understand that a little bit better.
And as far as obviously the younger population will be getting the shots a little bit more.
Yeah, less frequently. I would anticipate that. Again, you know, I don't want to say anything definite because
Right,
we're still
right.
waiting
We
for the
don't
final
know.
recommendations from CDC, but it may make sense that those older, more vulnerable folks would have a shorter interval between their boosters than younger individuals. So I think time will tell. You know, we're certainly learning, you know, as these new boosters become available, we learn about their protection, how effective they are in different groups of individuals. And using that information, you know, the public health leaders will make decisions about the frequency of the vaccine in different populations.
Absolutely. Well, we're about to run out of time, but before we do, I want to say thank you for coming down. Hopefully you'll come down again soon.
Yeah, happy. Thanks for the invitation to come. Nice to meet you in person.
Nice to finally meet you in person.
Thanks again.
Thanks a lot. On behalf of Dr. David Banach, I'm Pete Mezzetti. Thanks, good night, and we'll see you next time.